So again, today we're going to talk about the Ultherapy, the new ultrasound skin tightening device that's just been added here at Charlotte Skin and Laser. I want to thank all of you for attending and giving us your attention and time during the day. Hopefully everybody's sitting around with some lunch, and it'll make things go faster and smoother for you. So if we look at the aging face, there's a number of factors that affect the degree, nature, and amount of facial aging, and these include both what we call intrinsic factors, meaning anatomical structures and heredity, as well as extrinsic factors, most importantly sun exposure, but also smoking and environmental pollution. And these are things that we talk a lot about if you've been in here in the clinic, either for a general derm exam or for cosmetic work. Facial aging occurs at 3 levels, including the skin, as well as the deep soft tissue and the skeletal tissue, the bone. Changes in our bone structure lead to aging changes in our face. And if you've come in for a cosmetic consultation, chances are we've discussed these things, the skin as well as the loss of volume and bone that contribute to an aging face. We also talk a lot about collagen in skin aging. So collagen is the most important protein of our skin, provides structure to the skin as well as the deep structures below. Loss and degradation of collagen in the upper layer of skin can cause fine lines and wrinkles, and unfortunately as we age, not only do we lose collagen, but we're not making any more collagen. So a lot of our lasers and our treatments are designed to stimulate collagen renewal. What's different about the Ultherapy is now we have a way to stimulate collagen renewal in a very deep layer, as you'll see in the following in some other slides. The concept of beauty and youth is worth talking about a little bit. A youthful look has full lips and nice smooth skin, and there's a balance of facial structures. And as cosmetic surgeons, we talk about this triangle of youth, where the top of the triangle is the eyes and the eyebrows, and it tapers down to a point at the bottom of the triangle. So it's an inverted triangle upside down. However, with aging, the bottom of the triangle becomes your jawline, where you're heavier on your lower face and you get narrow at the top of your face, and there's more jowls and a downward slant to the face. Youthful beauty also has round convex surfaces. So when we talk about fillers and facial rejuvenation, we're trying to recreate some natural contours in your face and recreate the volume that's lost to help lift and support the skin. And today we're going to talk about how Ultherapy can help tighten the skin. The effects of aging can happen in terms of laxity. The brow falls down, and we also experience increasing in the jowls and lower cheeks, both due to laxity in skin, due to loss of collagen as well as elastic fibers, but also loss of volume in the cheek and temple area can let kind of the face deflate, if you will, and fall down, so you get larger nasolabial folds and some jowls and sagging under the chin. It also can cause flattening of the mid-cheek, and this can also accentuate those nasolabial folds. So enhancing facial structures isn't just about filling the nasolabial folds, but it's about recontouring the entire face area to get more youthful natural balance and those youthful natural contours. And this is a picture of Madeleine Albright. And I put this in here not to pick on this very lovely lady, but just it shows nicely some of the changes of aging. She has lines here along her forehead that come from muscle movement. And muscle movement here can create the 11 lines in between your brow. There's loss of volume in the temple as well as along here. This is both due to loss of subcutaneous tissue as well as bone. And this loss of volume here, even though she has great big cheeks, lets the face almost fall down, and you get heavier around the cheeks, the lower cheeks and jawline, and a little bit of fullness underneath the chin. We look at Betty Davis in her heyday, and then as an older woman, you see the triangle here, instead of being inverted, is flat on its base, and there's heaviness down here, as well as obviously skin changes and loss of volume here, letting this fall down. So the current concept of anti-aging is to address all aspects of the aging phase, volume as well as tightening the skin. And we often talk about the 4 R's of rejuvenation. And if you've been in for a cosmetic consultation, you may have heard some of these. In fact, we have a new brochure that kind of outlines these. The first one is to relax lines of muscle movement, such as in the forehead or between the brow or the crow's feet around the eyes. We use Dysport or Botox for that. We certainly want to address rejuvenation of skin with either lasers, chemical peels, or home skincare regimen. And restoring facial volume with dermal fillers can be very helpful. And we also talk about retightening the skin, and today our topic is Ultherapy and how ultrasound energy can be used to tighten the skin. In this cartoon, voila, no more wrinkles. Often it would be nice if we could just plump up the face and then put a plugger in it and be done, and that would plump and fill our wrinkles and lift the skin. And these two ladies, this lady over here is jealous. You're looking years younger, Doreen. Have you had some cosmetic surgery? Well, we really can't tie this knot here. And so how do we retighten skin? And are there non-surgical ways to retighten skin? And that's where Ultherapy comes in. Ultherapy uses tried and true ultrasound energy, commonly used for medical imaging. And it uses these sound waves to safely firm, tighten, and lift the skin tissue without disrupting the surface of the skin. So what that means is there's no wound to the upper layer of skin, no visible signs that you've had anything done. You can go about your business right after treatment without any visible changes. So Ultherapy uses focused ultrasound energy to deliver non-invasively and very selectively into the dermal layer, as well as the skin's deep layer. So here's the deep, deep, deep layer right on the fascia and above the bone or muscle, as well as in the skin layer, the dermis, up here. And these little focused deposits of energy stimulate and tighten collagen. This cartoon here shows the areas that we can treat. We treat the forehead and lateral temple area to tighten and lift the brow, so you get tightening of the eyelid skin, and we can also treat underneath the eyelid to tighten the lower lid. Treatment here along the cheek and the upper neck area is used to tighten the cheek and lift upward and help reduce the jowls as well as the under chin area. So what happens is over time this weakened collagen can tighten and new collagen is formed, so you get a more organized collagen structure to lift the skin. Ultratherapy is different than lasers. Lasers do tighten collagen. They do so in the upper layer of skin right up here, and most of the lasers that will tighten collagen will only do so with significant amount of downtime, wounding or healing that has to happen in the skin. So you're talking typically 10 to 14 days of downtime and then even persistent redness to get that tightening from a laser. Ultherapy can tighten the deeper dermal layer as well as the deep, deep fascial layer without any downtime or without any disruption of the skin layer here. The use of the ultrasound, and this is an example here, tells us exactly where we're depositing that energy. And this is the screen that comes up right before each Ultherapy pulse is delivered. We'll talk a little bit about who is an Ultherapy candidate, and we think that there are several factors that affect treatment response, including skin laxity, volume, skin quality, age, and lifestyle. If there's a lot of excess loose skin on the face or neck, it's going to be difficult to get the degree of improvement that we're looking for with just one Ultherapy treatment, or maybe not even with two. Also, if there is a significant loss of volume in the face and neck, the Ultherapy is not going to correct all that volume deficit. It will tighten the skin, but some correction of the volume is going to be needed to really correct the changes of an aging face. In terms of age, I think when you get 70 and above, there's definitely less of a response to laser treatments as well as the Ultherapy treatment. Your collagen just does not respond quite as well. It doesn't mean that someone 70 or older can't get a treatment. They may just need more than one treatment, whereas someone in their 30s, 40s, 50s, or 60s may get a nice result with just one. And this is an example of the skin laxity. So mild skin laxity, we expect a nice result, nice little tightening along the jawline and the chin. However, in a patient with a lot of loose skin, there's certainly a degree of improvement here, and it looks very much nice. And this is 3 months after the procedure. A second procedure might be beneficial to get even further skin tightening. In terms of volume, this has nice balanced facial structures, and they're tightened, and the jawline is redefined after treatment. But with severe volume deficit, we're not showing the cheek here, but the cheek is likely very flat, and there's loss of volume, letting the skin fall down, and you can see the loss of the jawline here, and that's both from loss of bone as well as the subcutaneous tissue contributing to the loose skin under the chin. So it's better and it's tighter, but we really need to replace that volume to further lift and balance the face. And then, obviously the Ultherapy can help a little bit with skin quality, but it's more for skin tightening and not for wrinkles. So this very wrinkled lady here has got an elevation in her brow that is significant and gives her a lot of lift off this lid here, but not a significant improvement in the wrinkles. And these are some results of the upper face. The Ultherapy is used, as we saw, to treat this area in here to lift the brow. And by lifting the brow, you get more lid show. So that loose tissue is stretched and you get more lid here. The under eye area also can look tighter and smoother. Same thing here. This woman with a very heavy brow before and then after the brow is lifted, you can see more area of lid show here. And this is where women like to put makeup and put a little eyeliner. And when that starts to go away, you start feeling tired and there's nowhere to put makeup. And another result here with a lot of hooding with loose skin, and that elevation of this brow up tightens that skin. On the lower face is where we see the improvements along the jawline and underneath the chin. Notice these pictures are all 90 days post-procedure. The changes in the collagen do take time to observe. You can see some small immediate improvement, but over time there's greater degree of tightening and collagen renewal over about 3 months, possibly even 3 to 6 months. And another result, just tightening the skin down below. So what is involved in the treatment? The skin is cleaned and we take before pictures, and we may give, depending on your level of interest, certain medications to help with the pain of the treatment. Some of you, if you choose to have a treatment, you may wish to have a driver, and we can give some more strong medications, and some people choose to do minimal medications and so they can drive themselves. It kind of depends on your pain tolerance, and we can discuss that with you at your consultation or over the phone. But there is no need to plan for recuperation or any time off from your regular routine or daily activity, only if you take some medication that you need to recover from. So the first thing that happens is the transducer, the handpiece, is placed on the skin, and we get this image, and this is the ultrasound image, and this is the depth. This is the upper layer of skin, and this is how deep the ultrasound energy is delivered. And we'll choose that area and then activate the ultrasound energy to be delivered along this specific line. And at each point delivers energy that then tightens the skin, and that heat also triggers a wound healing response that results in new collagen formation. There can be discomfort while the energy is being delivered. You can feel heat and tingling, And because comfort thresholds vary from person to person, we'll kind of discuss that with you and pick some pain control that's appropriate for you. We've done at least 10 treatments already, and the pain control has varied from nothing to nerve blocks as well as topical medication, and there's a variety of things that we can do to make the treatment as comfortable as possible for you. After the treatment, you can return to your normal activities right away. There may be some flushing or some redness just from the heat delivered to the skin, but that dissipates very quickly. It's not unusual to have a little swelling for a few days after the procedure, or even a tingling or tenderness to the touch in the areas that are treated. This is very mild and temporary in nature. So there's nothing that I worry about for you when you leave the office. You can do whatever you want. You can go on vacation. There's no problems with the treatment. There is a rare risk of a small bit of nerve irritation that can result in a little bit of numbness in the area treated or in one specific area or some tingling. But even that goes away with time and doesn't require any intervention. You can expect some initial tightening. We have seen that in almost everybody we've treated, but really we're waiting for the long-term effect to occur over 2 to 3 months, possibly 4 to 6 months. In the FDA-reviewed clinical trial, 9 out of 10 patients had a noticeable significant lift of the brow. The brow treatments were what was submitted to the FDA for review. In the other areas, they also reported better fitting skin, but that was not actually evaluated. Sometimes the results are subclinical, and what that means is unless you have a very visible jowl, you may get tightening, but you're not going to see anything on the surface. So those with loose skin will really see something. There is often this feeling that you get as you get older that when you bend down to do a toe touch or yoga or dig around in your pocketbook, you feel like your face kind of goes with you. Those cheeks flop right down. Well, because this is working down deep on the fascial plane as well as on the skin level, that tightening will help that skin stay in place when you move upside down. And so that would be considered kind of a subclinical. The collagen is there, the tightening is there, but not a lot of change on the outside. Also, Ultherapy is kind of like putting collagen in the bank. We talked about how as we age, we're not making any new collagen. So anything that you do that produces collagen for your skin is a step in the anti-aging direction. You are preventing additional aging by stimulating that collagen. So in summary, Ultherapy is a non-surgical, non-invasive treatment with no downtime that uses proven, safe ultrasound technology. The results are natural and very gradual, and it is a convenient in-office procedure. We are estimating most treatments are going to take about an hour to an hour and a half, and no special healing time or recuperation is needed. Commonly, we're going to recommend one treatment. If there's more need for tightening, we may anticipate more than one treatment and can talk to you about that at a consultation. Ultherapy has been noted a lot in the news, both on the Doctor Show as well as Dr. Oz, and in a lot of magazines. We're all familiar with the Vogue or the Bazaar article. So it's getting a lot of press because of the results that it's generating without any downtime. So we can go through some clinical photos now. And this is a woman before, and immediately after you see some tightening along the jawline, and this is just 2 weeks after one treatment. We're going to continue to wait for results for about 3 months. And again, a lot of loose skin, but you can see the immediate tightening right after treatment. Also notice the skin's a little red, and that'll fade in about an hour or two. This is a treatment along the lower face and the chin and upper neck area, showing nice tightening with this tightening. The upward here gets rid of this little jowl in the chin area for you. Really defines that jawline for her. And a side view of that patient with redefinition of the jawline and tightening here of the chin. And this is a gentleman with more loose skin, and this is him after 2 treatments, so 3 months after the second treatment, with a significant amount of tightening. You can see that if we address some of the volume here and here, he'd get even a more youthful, natural result by filling out that cheek. Another patient right along the jawline with some tightening. And this photo here also demonstrates these bands. These are muscle bands. They're called platysmal bands. And they can tighten a little bit from the skin tightening from Ultherapy, but in general, Ultherapy is not going to take care of this muscle band. We can use Botox. Botox right into these bands can cause those bands to relax and fall back against your neck in a natural pattern. If these are very significant, often the only way to treat these is with a surgical procedure through the front of the chin, where they're kind of sutured together. Even then, often Botox is needed after that treatment to keep them relaxed. And a nice improvement along the chin and jawline. Same thing, a little bit under the chin. And I like this photo because a lot of women come to me with this kind of chin. They want some improvement. We can certainly do liposuction there, and I think liposuction is a great, simple, very easy for the patient procedure. It's done in office. But when you just have a little bit of chin here, it's often hard to think about doing a whole liposuction procedure and the healing time from that, particularly now when you can get this kind of tightening with the Ulthera. So I think this is a nice result. If she was a lot heavier here, we'd be more inclined to recommend some chin liposuction if she's interested. Some people also have kind of a surgery and needle phobia, and then the Ultherapy can be a nice alternative to tighten up the chin and jawline for them without any surgery. Another gentleman, and this gentleman here, there's a lot of loose skin. And so to address this, we don't really have a whole lot. The liposuction won't do it. There's just not a lot of fat here. If you were to roll this between your fingers, it would just be skin, just loose skin. And a lot of men wish to avoid neck lifting or face lifting type procedure, and that's what would be needed to completely take care of this. So I think he gets a nice tightening with just one Ultherapy treatment. He might get more from a second one, and that's a profile view of that. So this is a nice technology for these patients that we know we can't help with liposuction and they don't want to have a face or neck lift. Another picture showing just the tightening along the jawline and chin. And again, you see the platysmal band kind of shadowing, and it's better here, but Botox can help that even further. And a nice improvement on the chin. And this is a brow, and what the therapy does is raise those brows so you get more lid show right along here. So that upward movement of the brow pulls up this eyelid skin. Usually in the brow treatment, I will also recommend that we do Botox in this area. And these are muscles here are called the brow depressors, meaning they pull the brow down when you frown or squint in the sun or squint trying to read the paper. Botox here relaxes those so they're not pulling down on the brow. We don't want them pulling hard down when we're trying to get the collagen tightening pulling up. We don't want it to counteract what we're doing with the Ultherapy. And this is a patient that, honestly, I would probably recommend chin liposuction. I think chin liposuction would give her a terrific result, 3-day downtime. But patients, for various reasons, or maybe they're on medications and they can't do a procedure, wish to have something non-surgical. And I think she's gotten a nice definition of the jawline here and tightening. And again, she might benefit with a second treatment for even further tightening. And that's just showing a tightening along the jawline in a patient that obviously looks very youthful. And this is the kind of patient where the result might be subclinical because there's not a lot of loose skin. But I think the definition of her jawline is very good looking here. And here's somewhere where we expect to get some good results. a mild to moderate degree of loose skin that tightens. And look at the cheek area here, how much it smooths and tightens. Now, the Ultherapy technically is not a wrinkle treatment, but sometimes with this drape-like effect, that tightening up can correct those drape-type lines. And another chin with a nice result. And this is another example of those platysmal bands, those muscle bands that will only respond to surgery or Botox. Another great looking chin here, and again, there's just not a lot here, but a lot of people don't like this. You can kind of grab it with your fingers and it shows up in pictures and people don't like it. And you can do some suctioning here. It won't do a whole lot, but I think the Ultherapy kind of redefined it and reduced it in a nice way, and probably even a better way than we can do with surgery. And I think this woman gets a really nice result in this almost bunching of the skin underneath the neck, and that tightening up along the cheek and jawline can tighten that. And this is a nice result around the eyes. It almost looks like laser treatment, but this is just Ultherapy, tightening this loose skin fold and tightening along here. And same thing along the lower eyelid. And another chin. And nice tightening along the jawline. So to me, to get this kind of result without any surgery and without any downtime is really remarkable. And of course, individual results will vary, but I think consistently we do see tightening in each patient, which is nice. The cost of the treatment for the eye area is $1,500. There's a special to the end of August, which is $1,200. The lower face and neck is $2,200, and until the end of August, it's $1,900. And for the full face, it's $2,900 with a special until the end of August of $2,500. And I want to thank all of you for participating and joining us on your lunch hour, and hopefully inside. It's so hot outside. So if you have any questions, I will stay logged on for a little bit and try to answer them for you, or you can email us at our website, info@charlotteskinandlaser.com. We'd be happy to answer your questions for you. And happy weekend, everybody. Bye-bye.